Hello, my name is Angela LaRiviere. I am a family and youth advocate. I've worked with youth in Ohio for the past 20 years. And today I'm going to be talking to you about some facilitated discussions that we have held in partnership with Healthy Kids Learning Communities around Ohio over the past 6 months. The opioid crisis in Ohio has reached an epidemic proportion. As part of this initiative, we have held a series of focus groups in order to gain feedback and input from youth, young adults, family members, and community agencies. We hope that with that information we have been able to gather from participants to be able to inform our partners and conduct larger research projects to advocate for better services to meet the needs of local communities throughout Ohio. In order to understand the impact of the crisis with families and youth, discussion groups were held to identify concerns and make recommendations. These discussion groups were held in Northwest, Southwest, Southeast, Central, Upper Northeast, and Lower Northeast regions. We also held a special statewide meeting, and they included families, youth, and some service providers. Again, the activities that were conducted were meant to explore the impact of the epidemic and give voice to new ideas and concerns, also to explore strategies and models that will better serve youth, parents, and communities. For these groups, we followed the same agenda with an opening and introduction activity. We went over goals and expectations. We spent some time defining the problem. We gave participants activities that they could provide written feedback, working together to identify what they considered members of their community, then exploring resources that currently existed and making recommendations on how to improve those resources. We also conducted evaluations, and then we wrapped up for the day. So the first thing we talked about was being able to define the problem. Pretty much across the board, we had similar answers to what the problem was. What we know factually is that this is having a big impact on children, particularly through the child welfare system. So just going over some facts of what we already know is that 50% of children taken into custody had parents who are actively using drugs. 70% of children under the age of 1 had parents that were actively using opiates or heroin. We've seen big improvement or increases in family and relative placement. It's been up 62%. And while that number's been up, there's been a decrease in funding and a shortage in staff. And all of that puts us as 50th in the nation for state funding and support for child welfare. The source of that is the Public Children's Services Association of Ohio, and also the following couple of slides. Ohio is the second worst state in the nation for drug overdoses, with Dayton ranked #1 with the highest per capita, 6th for most deaths, and again, that increase in child services placement and a decrease of funding. That's what we see, that increase in numbers. What we don't see are other families and friends who have doubled up with grandparents or other relatives due to their addiction, but aren't officially involved because of different reasons, either overcrowded system or fear of the system. That's what we found in our discussion groups. So the first part we did was give the participants an opportunity to answer some questions in written form. So I pulled 3 of those questions and some highlights from their answers. The 3 questions were, what is the biggest issue facing your community? Most cases, drugs or opiates or overdoses were indicated as the top, but we also wanted to see what else was on people's concerns. One barrier to accessing treatment or services, and what is the most important thing you need to help a friend or family member. So some of the answers for the biggest issue, again, drugs and violence were the top too, but some of the other things had to do with poverty, lack of supportive services. Also, a lot that the youth talked about was their peers and attitudes about it's okay to get high. And a lot of the discussion around that was coming from either a family culture of addiction or from peer pressure. There was also some concerns about lack of awareness around trauma and addiction, getting to root causes, the lack of mental health treatment for children who are in those families, particularly in foster care, and that there was not enough things to do in the community for children and youth to have alternatives to hanging out on the street. One barrier to accessing treatment or services, a lot of the answers had to do with transportation or access. Access also included not having medical coverage. Most of the youth talked about their age and being able to self-direct services or request on their own without parent permission, lack of inpatient beds for youth, and lack of services that covered low-income areas. In rural areas specifically, talked about not having enough treatment centers in their area and having to go out of county for services, and that a lot of families could not provide the transportation or the support to get to those follow-up services. A big conversation in several of the groups was the lack of school-based services. They felt that school-based services had the biggest reach, particularly to young adults who were early in their addiction. And the fact that you have to get in trouble first before people take notice of the problem. So there was a lot of discussion, which we'll touch on later, about having to escalate before there's an intervention. The most important thing you need when helping a family member or friend is access to resources. There were many people who talked about not understanding how to self-refer or who to call to get services for someone else who needed help. Another thing that the youth were concerned about is not having peer support or a positive peer system who were knowledgeable about resources. They also looked again at needing professional guidance in their communities, and that they valued having workers with personal experience. So again, there was a lot of conversation around peer support or having more emphasis on personal lived experience as a way to build trust. So we kind of defined the community when we were talking about their roles, their barriers, the supports, and recommendations. The community that was identified were their self, peers, family, police, emergency responders, schools, government, treatment programs, inpatient and out, courts, child welfare, and then a general category of other community agencies. This included churches, community centers, after-school programs. They also talked a lot about housing. So I'm going to highlight a few of those and just go through some of the responses. So I think schools was the number one area of conversation, both because we did focus groups with youth, and those youth were 14 to 24-year-olds, and one focus group we did have a 12-year-old. So really talking about how much pressure is put on schools, and also the lack of inclusion of schools and the role of schools when people are making decisions about funding services specific to the opioid addiction, and also what their role is in providing supports. Because we know schools are getting the impact in their classrooms and seeing behavioral issues with children both who are addicted and who have parents who are addicted. So, but they don't feel like there's a widespread conversation about what they could do in any kind of a formal sense. So, of course, the role of schools is to teach, provide support, and prepare for life. All of these responses were written by small group discussions and then also a big group discussion. So we recorded, these are direct responses. The support that schools offer, a lot of youth said this is their safe space, that they feel they could go there to get basic needs met, particularly for younger children. When parents are addicted or checked out, they're not necessarily receiving consistent meals at home, that their basic needs are totally dependent on schools to provide breakfast and lunch. Peer-to-peer mentor opportunities, and also building trusting relationships with adults, which a lot of them said they did not have in their family life. So the barriers for schools is that a lot of families and also youth were afraid to disclose too much because of mandatory reporting, that there were not enough behavioral health supports in the school setting, and that there was not enough funding or transportation to activities that do exist. So if they didn't have a parent who had transportation or a parent who was not functioning, they couldn't get to after school or weekend activities. So recommendations that were written by the small groups were better defined roles and expectations, more funding for behavioral health supports, and trauma-informed training for teachers and administrators. So an interesting community conversation was around police. Every group spent a lot of time talking about the roles of police, and I'll just say personally, I was surprised by the discussion. We had one group of youth who were primarily from the juvenile justice system, and they said that their primary barrier was that they wanted more police in their communities, and a lot of groups said this. They liked resource officers in schools, even if they sometimes act like they don't. They felt that the support they got from them was safety from drugs on the street and crime intervention. In the rural area, the youth primarily and also the family members stated that because of funding issues that they were down to maybe one police officer or one sheriff in the county, and that they felt they really needed a lot more police support. In a couple of the urban areas, particularly in the Northeast, youth identified that same thing. They thought there was not enough police support in the neighborhoods where there was a lot of drug activity, and that they really would appreciate more police support in order to feel safe, particularly when they would go back and forth between programs or agencies. One group of urban youth said that they felt they had a lot of police presence, but they didn't really understand what the police role was, because they see a lot of drugs in their neighborhood and a lot of drug deals and violence going on, but they did not see a lot of police intervention until escalated crisis. So I think what the consensus was in that group was that there was police, but they needed to get to know the community better so that they could understand where they were and what their purpose was. So recommendation was more training for police and crisis intervention, more funding for additional officers, to create programs and building relationship with the police, and better background checks to know about officers' criminal or drug history, That was from one particular community in the Northwest who was concerned about some possible corruption in their neighborhood. That's what that comment came from. So the courts, 2 groups of the 7 brought up courts as a primary community participant that could have a big impact on these issues. So to provide justice, punish crime, and provide intervention. One of the biggest things that was talked about in terms of the role of the court is that their ability to be able to mandate treatment. And then the discussion kind of broke out about what that meant and who should participate. So drug courts, family interventions, and mandating treatment were the positive supports. Barriers were that while there's all the supports that courts are starting to provide have been largely positive comments, that you really have to escalate before they're able to intervene, that there's not enough drug courts or mental health courts, and the fact that you have to go to court to be able to get these services. So recommendation was to spend more funds on prevention and early intervention, to look for trauma-informed punishment, and to include the entire family in treatment or in a plan when and where it can be mandated. A lot of youth across the board felt like because children and these older youth, the teenagers and young adults that participated, were talking a lot about their experience when they were younger, and also of younger siblings or children they know as being sort of the scapegoat because they don't know how to deal with the family crisis going on, and a lot of times it comes out in a behavioral health issue to which they're being punished. A lot of people felt that it's easier to punish the child than the parent. And so a lot of the discussion around including the whole family, I think it goes on both sides. One is to make parents accountable and to figure out what's going on in the whole house before punishing the child and putting the whole weight of the situation on the child's behavior. And also when a parent gets into treatment or maybe into the justice system, that system looks at the needs of the children in that family. So that was a lot of to create programs to build community relationships and understanding of the court's role, and to attach punishment and reward to treatment. So child welfare, we talked about in the beginning. So as defined by our groups, it's to make homes safer, to find placement for kids in crisis, and to provide case management support services. As we see these comments kind of match the crisis that we're having for child welfare and not having enough funding, and for our system being overloaded, currently overloaded. So the support was all mostly positive comments about child welfare, that they could provide support for the families, that they can make referrals to treatment, they can represent the child in court and mandate services to parents. They could also get services for kids, provide follow-up and check-ins. The barriers, which we talked about being overloaded, that there are so many calls that a lot of calls go not, that there's no response to calls or callbacks, that there's not enough placements, that relative placements sometimes are with other drug-addicted family members, that there's no support and inexperienced workers. Recommendations that came about was more funding was number one, so that they can do their job effectively, provide more support for older youth when placements are not available, because they found a lot of times that older youth were not put into placement as much as younger youth, but that they still should be acknowledged and given treatment, to find better prevention and in-home supports before taking custody, and to build better partnerships with the families and the youth, and to work on building trust in the communities. And this had to do with the reputation of children's services. There was a lot of feeling that children's services has a scary and a negative view from particularly young children and in the community, and among parents, that they have no trust of the child welfare system. So others, just a short little overview of other parts of the community that were discussed. For the self was to take care of yourself and ask for help when needed. I think the most fascinating part of these discussions were around the barriers of not recognizing when there's a problem, depression, mental health issues, undiagnosed mental health issues, and self-hate were the barriers of being able to take care of yourself and not having resources. And then to be self-motivated, the support of yourself is that you know you better than anyone else, and that there should be more outreach and information available to individuals. The family role was looked at as should be the primary caregivers and support, and they should participate in treatment. The barriers was that a lot of times they don't, that there's a culture of addiction, poverty, and generational issues that create barriers and no trust in the system. The support is that even in some of the worst scenarios, that there still is a sense of love and trust and loyalty. Particularly loyalty was a theme when talking to some of the youth about their family. They don't want, even if they have a negative view of their family, they really don't want other people to, and they want their family to do better. And then, of course, practical resources and a place to live. The recommendation is, again, around a whole family treatment plan and resources, and then peer support was brought up again. For peers, there was the barriers and support were the same. Like you could have negative influences, peers, and if you had a good peer, that could be a positive. One of the barriers was lack of experience and peer pressure and fake friends. And I think that's just kind of across the board for teenagers and young adults. The good thing, and I think this does make peers a primary point for the other youth in particular, and probably for the families, although this wasn't discussed as much in those groups, was that they're available anytime, that there's an instant camaraderie, kind of open and honest relationship, and that it's anytime. So they could text their friends at 2 in the morning, or they could call them in a crisis, and they felt like a lot of times that was the only person there for them that they could be truly open and honest with. And if they needed a place to stay, a lot of them indicated that friends, if there was a crisis at home, that's the first place they would go to is their friend's house. Recommendation is to include their friends and their peers in their treatment plan and provide training for them. First responders, there was one major issue I want to point out about first responders, was a big discussion in the rural communities about response time, and that there could be some kind of cross-training with families and youth, particularly if they were in a family that had a history of drug use, where there could be possibly an overdose or another immediate crisis. And there was a 17-year-old in one of our groups that really gave a really heart-wrenching story about coming home from school. He was living with a relative, and that relative had OD'd. He knew that she had Narcan in her purse, and he didn't know anything about it, but he opened it and he read the instructions and he was able to successfully administer it to her while they waited for the emergency response. And the youth in the rural community said it could be up to 30 to 45 minutes just because of distance and lack of funding and lack of emergency response teams, that it could be 30 to 45 minutes. And they felt that even if they were 15 or 16 or 17, that they really could benefit from some training around how to intervene in that crisis while they were waiting for emergency responders, particularly if they're from families that have these issues. The other part that was attached to that was the 12-year-old who participated had a recommendation that schools revise their drug training and their drug curriculum in schools, because he felt that while they had DARE and other programs around drug use in the schools, that his words were, it's elementary. This is stuff that I've learned from TV, the internet, and my family since I was 5 years old. And he felt they really need a more advanced discussion on drugs particularly and what was happening in their community. And he felt like there was a disconnect between what the teachers felt they were ready for and what's actually happening in their families and in their community, which I thought was a really powerful discussion about what they're seeing both at home, in their neighborhoods, and on the internet versus where they are in school in terms of what people see as appropriate for their age group. So other community resources, we talked about a little bit that they have housing, they're better embedded into the community. There's no evidence. The barrier was they're not evidence-based largely, that they're more grassroots and so therefore not funded. Transportation was kind of a barrier across the board, and that they could provide services that could be incorporated better into a treatment plan for families. So treatment centers, probably hear this across the board, was lack of beds, too far away, not enough funding, and not enough family-based services. Recommendations was better follow-up, inclusion of the whole family, and community referrals. So to wrap all that up, we took all the information and put it into 10 common priorities of what we could do as advocates that seem to be common themes. So the first one is flexibility in funding community-based solutions. These are not in any priority order, just to let you know. No, not only evidence-based, but also to allow some flexibility in funding for new ideas that are specific to each community needs. To support interventions for families through child welfare before the crisis escalates, and also support for older youth who might be unattached from families, but still under 18. Strategic partnerships with community-based agencies, including like Y programs, community centers, faith-based and after-school programs, and housing, to be able to provide a whole community support, kind of like a wraparound theory for the families going through these crises. Better communication between government agencies and local community agencies and people with lived experience. So we felt that the government and the role of the government is primarily just to provide funding and support, but also that they couldn't guide how to fund projects without a better communication with local communities, particularly formats to hear from people directly. Focus on culture, mental health, and trauma training for police. Those were the three training that the groups felt across the board were critical for police because they're the first responders a lot of time in a community. funding and support for school-based services, including behavioral health services, trauma, community resources, and intervention training for teachers and other school administrators so that they understand what the community plan is and how to support their families so that the children and the youth in those families can be more successful in school ultimately. To access self and family referrals to treatment facilities and better information about how to do that. Funding for professional peer support services for families and youth. So increasing drug and mental health intervention and diversion programs in the court system. And finally, including the entire family issues and dynamics being considered when treating children and youth for behavioral health problems. And that comes back to asking providers to look at what's going on at home, if children are acting out at school or in other arenas, to not just take face value, but to explore what other issues might be affecting their behavior. So a couple of things in wrapping up that were significant to me was the fact that there was so much discussion around the relationship between police officers and youth and young adults. I found a lot of the conversation to be probably surprising to adults of how much the youth actually were expressing support for the police officers and the work that they were trying to do in the community, and also for requesting more services from them and more interactions with the police. I think that was something that was across the board from community to community, and also very unexpected in the discussion groups of how much there was an emphasis on providing more funding and support and training for police officers to be more effective, and also building that relationship. And the second thing that I thought was a prominent across the discussion was supports for teachers and administrators in school, and adding more on-site mental health, behavioral health services in a school setting so that schools could be more effective ultimately in teaching those students. So we wanted to thank all of the families and the youth that participated in this project. We really value their input, and I hope that you're able to use what they've said in developing better programs, or at least in your personal work of how to deal with the families that are in crisis, and reflecting on some of their recommendations that have been made through this process. For more information, there is some resources here. You can also go to Wraparound Ohio and look through the Healthy Kids Learning Communities to find more resources on this topic, both now and coming up in the future through Case Western, and the work that they're doing around the state. And hopefully we can become better advocates and utilize this information in the future. Thank you for participating.